Today we will learn about popliteal artery. Popliteal artery is the continuation of the femoral artery and it begins at the opening in the adductor magnus or hiatus at the junction of the middle one-third and lower one-third of the thigh. It runs downwards and laterally to reach the lower border of the popliteus. In the popliteal fossa, it is the deepest structure. It terminates at the lower border of the popliteus by dividing into the anterior tibial artery and posterior tibial artery. Let's discuss about the branches given off by the popliteal artery. Several muscular branches are given off from popliteal artery. The upper muscular branches supply the adductor magnus and hamstring muscles and end by anastomosing with the fourth perforating artery, whereas the lower muscular branches or sural branches supply the gastrocnemius, soleus and plantaris. Cutaneous branches either arise directly from the popliteal artery or arise indirectly through the muscular branches. One of the cutaneous branches accompany the small saphenous vein. Now let's discuss the genicular branches. These are 5 in number. The superior medial and the superior lateral genicular arteries wind around the corresponding femoral condyles, whereas the inferior medial and the inferior lateral genicular arteries wind around the corresponding tibial condyles. These 4 arteries participate in the genicular anastomosis around the knee joint, whereas the middle genicular artery pierces the oblique popliteal ligament of the knee and supplies the cruciate ligaments and the synovial membrane of the knee joint. See the terminal branches, which includes the posterior tibial and the anterior tibial artery. The anterior tibial artery is the smaller terminal branch of the popliteal artery. It begins on the back of the leg at the lower border of the popliteus opposite the tibial tuberosity. It enters the anterior compartment of the leg by passing forwards close to the fibula through an opening in the upper part of the interosseous membrane. The posterior tibial artery is the larger branch of the popliteal artery and it enters the back of the leg by passing deep through the tendinous arch of the soleus. In the leg, it gives off a branch called the peroneal artery. Peroneal artery is the largest branch of the posterior tibial artery and it runs obliquely towards the fibula and descends along the medial crest of the fibula accompanied by the nerve to the flexor hallucis longus. There is one clinical point for popliteal artery, that is, it is more prone to aneurysm than any other artery.